Hello, everyone. Thanks for joining us today. I'm Marche, the webinar director at Advice Chaser. Before we introduce our guests and get started, I need to do a bit of legal housekeeping. Advice Chaser, the host of this webinar, is not a registered investment advisor. We cannot and do not give financial advice. Today's presentation is for educational purposes only and cannot be considered advice for any person's individual situation. Advice Chaser regularly hosts informative webinars, such as this one, featuring a variety of knowledgeable professionals, many of whom are licensed advisors. Any opinions, ideas, jokes, or principles expressed by presenters are their own, and however true, funny, or interesting, are not endorsed by Advice Chaser. Please do not act on the information you hear today without consulting a qualified financial professional. We're thrilled to bring you this educational presentation. Attendees are muted, but we encourage you to ask questions using the chat box. The presenters will answer those queries during or after the webinar today as appropriate. If you ask a question in the chat box and we don't have a chance to get to it, go ahead and leave your phone number as well. If we can't get to your question during the event, we'll make sure someone reaches out to you after today's event. We want this experience to be as educational as possible, so please don't hesitate to ask for clarification or expansion of the material. I'd like to introduce you to our panelists today. Our moderator today is Tyler Henley, a financial advisor based out of North Dallas. Tyler and his firm's focus is to build, manage, protect, and transition wealth for a select group of clients. Their expertise is in retirement planning and working with business owners. Tyler is a CFA charter holder and has an economics degree from Rice University. Tyler has a passion for serving others and loves making sense of the financial markets for his clients. Tyler, why don't you go ahead and say hello, a few words about today.
Hello, everyone. Thanks for joining us. I am excited for this topic today because I've seen how this information can impact others, and more specifically clients that we have. So hopefully you find it informative and helpful. And again, as Marche said, if you have any questions, we'll do our best to get to those. But look forward to hearing from Andy.
Our presenter today is Andy Hardwick, a Metropolitan Public Affairs Specialist for the Social Security Administration. Andy graduated from Brigham Young University with a degree in modern languages, subsequently earning a master's degree in modern psychology. He started working for the Social Security in the New York City area in the disability program. And since coming to Houston, Mr. Hardwick has been involved in public outreach for the Social Security Administration. And Andy, we've had you here before. We're excited to have you share content again for our listeners and for our viewers. And I would also like to maybe put in a little caveat here. We have on our YouTube channel another presentation with Andy and also some other presentations about Social Security. So what we're talking about specifically today, if you have other questions that are more general about Social Security, we do have educational content for you as well. Andy, I'm going to go ahead and stop my share on my screen and you can go ahead and share your screen.
Okay. Everybody see that?
Yeah, we can see that fine.
Okay. Thank you very much, Marche. Thank you, Tyler, for being here and for everybody for tuning in. My name is Andy Hardwick, and I am in charge of public affairs, mainly in the greater Houston area. And as has been said, I started working for Social Security on the East Coast, but my family and I have been in Texas for the last 33 years. So this is where we raised our kids. All right, so today we're going to talk about work incentives. Work incentives is another word for work supports. These programs are to help people who are getting Social Security go back to work or try work for the first time. I said Social Security, but it also refers to the SSI program. So some of the information may be useful for yourselves or family members, adult members who want to go back to work. Some of it may be useful if you have young people with disabilities, where the school has them in transitional programs and is encouraging them to go to work, and you're fearful that maybe they're going to lose their benefits, especially Medicaid or Medicare, in case they go to work. And that's not necessarily the case. So we'll talk about that. All right. So as I said before, work incentives are in support provisions that assist beneficiaries in moving from benefit dependence to independence. In other words, we want to see how many people can eventually get off of disability benefits and come back to or start in the workforce and become independent of receiving any government benefits based on disability. Now, I know that's not the case for everybody, depending on the severity of a person's disability, but these programs are just intended to kind of get your feet wet and to see if this is an eventual solution for you or a family member. So we're going to talk a little bit about disability programs, what Social Security considers to be disability, and substantial gainful activity. All right, so we have two programs that offer disability benefits. Title II, also known as SSDI, which stands for Social Security Disability Insurance, and SSI, which stands for Supplemental Security Income. SSI gives you Medicaid, Social Security gives you Medicare. Now, people sometimes get SSI mixed up with SSDI. SSI, as I said, stands for Supplemental Security Income. It has nothing to do with the Social Security program. SSI funds are not taken from Social Security trust funds. Okay, it's an assistance program for people who have limited assets and income, or possibly none at all, who are severely disabled or visually impaired or are 65 years old or older. The Social Security Disability Program is also for the same category of people with disabilities, but there is not a question of, in most cases, we're not counting income against disability, except if it's income from work. And resources or assets, that's not a factor in Social Security, because Social Security is an entitlement program. You have to work a certain period of time and earn it, whereas with SSI, work is not a requirement in most cases. So let's talk about disability. Disability, according to Social Security, is having a condition which has lasted or is expected to last at least 12 months and may result in death. Substantial gainful activity is a term that we use to measure if a person is engaging in full-time work activity. So if a person is working and making over $1,310, $1,310 gross per month, they're considered as engaging in substantial gainful activity. And if they're earning this amount when they're applying for disability benefits, their claim would be denied on technical grounds. It would be denied on the fact that, based on the fact that they are engaging in substantial gainful activity. In other words, their gross earnings exceed $1,310 per month. If a person is visually impaired, then that amount would be $2,190 per month. Now, we have what we call these employment support programs or work incentive programs, where depending on the situation, there may be a certain portion of a person's gross earnings that we're not going to count. Okay, so we'll go over these right now. All right, so one of them is subsidies and special conditions. A subsidy is a support provided by an employer, which may result in a person getting more money or getting a larger wage than the actual value of the services that they perform. Okay, so let's say you have a young person, son or daughter, that is coming out of high school, and they're working in a warehouse, and they're working for a neighbor of yours, and they're getting paid $1,500 a month. Okay, But actually, this neighbor who's known your child since they were little, you know, he has other young people working in the warehouse. Your child is perhaps, due to his or her disability, is unable to do the same level of work that the other young people are doing. But because the owner of the company or the warehouse knows you, your family, and your child, they pay them the same amount as the other kids. That would be considered, or part of that pay might be considered a subsidy. So we would contact the employer and we would ask him or her, what are they being paid? What is the actual value of the work they're performing? So even though they might be paid $1,500 a month, if the employer answered and said, well, the value of the employment or of the work activity that they perform in a month is probably closer to $1,000. So that extra $500 would be considered a subsidy. So we would not count that in calculating the Social Security or the SSI benefit, because we would say, well, the $500 represents a subsidy because that's extra money they're being paid for work that they're actually not doing. So that's one of the supports we have. Unsuccessful work attempt. If a person goes to work and
Andy, can I interrupt real quick? We had a question regarding hours worked in a week. Someone had a question that said they have someone that is currently getting SSDI and works 24 hours a week because they were told that if they exceeded 24 hours, they would lose that SSDI benefit.
We measure whether a person can get benefits on the amount, not the number of hours that they worked. Okay. So I don't know what the rate of pay is. Maybe if they worked more than 24 hours, 20 hours a week or 24 hours a week, then
right,
possibly their monthly pay would go over $1,310 a month. And that might result in them being cut off of SSDI. But there's more things in there. They wouldn't necessarily be cut off right away. So I'm going to go into that in a minute. So I think I'll be able to answer that question in more detail in a few minutes. Okay. So an unsuccessful work attempt is where a person may be earning over that 1310 and possibly eventually their Social Security checks would be stopped. But then within 6 months of their check stopping, the level of their work goes down to below that $1,310 per month. We could start their checks up right away. We could consider that an unsuccessful work attempt, that they tried to earn a larger amount of money than they were capable of actually earning due to their disability. They had to cut their hours. That would be an unsuccessful work attempt. Impairment related work expense. Certain expenses that a person has in order to help them go to work, we can also deduct those expenses from a person's gross pay. That means that we would count less of their gross earnings in determining their Social Security or SSI amount. So in the example they use here, a person's earning $1,200 per month gross, but a medication that he or she takes in order to help them go to work is $75. So we subtract that, and that means that we're actually counting $1,125. Okay. There are other impairment related work expenses: transportation costs, attendant care services, service animals, medical devices, prescription drugs, residential modifications. So let's say your child is working at a place that is only accessible by taxi or by Uber. Okay. And there's no other way they can get to that job. Well, if the Uber cost is $400 per month, you write that up, you submit it to Social Security as an impairment related work expense. If we approve that, that means, for instance, if your child were earning $1,400 a month and $400 went for transportation, we would only start counting the $1,000, not the other 400, not the 400 of the original 1,400 that they earned, because the 400 would be an impairment related work expense. Okay, if a person goes to work, they need their caregiver or that person needs to report that work activity on form SSA 821. And I believe you can download that from the from our internet site, which is socialsecurity.gov or ssa.gov. Okay, so it's very important that you let us know that this individual is working, or that you are working if you are the person getting the benefit and you're getting paid directly. It's important because otherwise you could be overpaid, or your child could end up being overpaid, meaning that money will be owed to Social Security, and that means that their future checks are going to have to be cut so we can recover the overpaid amount of benefits. Plan for achieving self-support.
Real quick,
Yeah,
before you
go
get to the
ahead.
next slide, we had another question as it related to that $1,310 a month,
Mhm.
the limit to be able to receive those benefits. Has that increased over time? Does that adjust over
Yes,
time?
every
with the
year,
cost
every
of
year
living?
it goes up, every year. Mhm. And it will change next January. That's the way it does every year.
And just for the people who may see this as a recording later, we are recording during 2021. So this
Right.
is accurate as to right now, but it will change in the future.
2022, yes. Okay, plan for achieving self-support. Let's say that a person is getting Social Security of $1,000 a month. Well, the highest SSI amount is $794. Let's say that they want to get Medicaid and SSI also to supplement their income. Well, perhaps this person that's getting $1,000 a month, they never went to college. Now they went and talked with the folks on the college campus. They talked it over, and they brought evidence over that tuition and fees were going to be approximately $1,000 a month. In other words, it was going to take the whole Social Security check to pay their tuition and fees for the whole year, that every month. So approximately $12,000 a year. Okay, so you come to Social Security, or well, actually, you could get the information. You could download the form online, and you fill out the report that this is my vocational goal. Let's say this person wants to be a teacher. It's going to take 4 years, and by current estimates, it's going to be $1,000 a month for tuition and fees. You write it up, you submit it to Social Security. If we approve it, that means $1,000 a month that the person is getting, which would normally make them ineligible for SSI, is not counted at all. So now they could go ahead and apply for SSI, potentially receive $794 a month, which is the maximum amount of SSI per month in Texas, and in many states, I would say in most states, and they would also get Medicaid. So they would still get their $1,000 a month from Social Security, an additional possible $794 a month from SSI, have Medicaid, and after 2 years of being on Social Security disability, they receive Medicare. So they can have Medicare, Medicaid, $1,000 a month from Social Security, and $794 from SSI, if they're going ahead with their plan for achieving self-support, meaning this is their vocational goal and they're going ahead with their plan. Now, if they drop out of school, they need to let us know right away, and then that Social Security income counts again, and that would cut them off of the SSI program. So it's important that the person stick to their plan for achieving self-support. Now, it is possible after a certain time to come back to Social Security and say, well, I want it to be this, but now my vocational goal has changed, and we could make some amendments in the past program, and they could continue on their past program. Okay, and that, which means that we would continue not to count part or almost all of their income. All right, so this plan for achieving self-support can help pay for school, training, expenses, tuition, fees, books, uniforms, attendant care, transportation for work, employment services such as a job coach, and supplies to start a business. So here's an example that they use. Now, this is an example with the SSI program, not the SSDI. SSI is the check that comes on the first of the month. This is the assistance from the federal government. So this person is earning $665 gross per month. So under the SSI rules, we don't count the first $20 of any income they might have. That would leave $645. Then we don't count another $65 of any earned income they have. In other words, any income from wages, that will leave $580. Then we divide the remainder by 2. That leaves $290. So that's what we would count against their SSI. But now Billy comes to us and he says, I'm going to use the $290 a month on my education. This is my vocational goal, and I've calculated that it's going to cost $290 a month. So the $290 a month that normally we would have counted against their SSI, we don't count because we approved their plan for achieving self-support. So now their SSI, instead of being cut by $290 because of their $665 gross income, actually can stay at the same amount. Assuming, let's say it's $794, it would still stay at that same amount. So Billy could be working, earning $665 a month, and still receive his SSI of $794 per month. Okay, here's another one, and I think this was similar to the example that I gave with the Social Security about Maria wanting to go to school to be a paralegal. She gets $804 in Social Security disability benefits, and Maria determined she needs $784 per month for tuition, book, school supplies. So we can deduct the $784 from her SSDI benefit, meaning we're not going to count her original SSDI was $804. We're going to subtract $784 from that, then subtract another $20. And that means that we don't count anything against Maria. So Maria can continue getting her $804 per month in SSDI, apply for SSI, and possibly get $794 a month in SSI benefits. Again, Maria has to be using this money for school. If something changes, she drops out of school, she needs to let us know right away because otherwise she'll be overpaid. Okay, we have Ticket to Work. Ticket to Work is a program where we can train people with disabilities to go back to work or to start working in some kind of trade or occupation. So it's free and there's no penalty for using it. And normally we review disability cases every 3, 5, or 7 years. But while a person is under a Ticket to Work, we don't do a medical review. Okay, and there's a number, and we're going to share this slide with folks later. So you can call if you're interested in your child receiving, or you yourself, if you get disability benefits, getting a Ticket to Work and being contacted by an employment network that will provide training for jobs. Okay, Expedited Reinstatement. This is like a safety net. If we stop your benefits because you're making over $1,310 a month gross, and you still have the same disability, if within 5 years you're making less money than the $1,310 and we stopped your benefits, we can start your benefits right away within 5 years. Okay. Now,
while we have just a break here, Andy, real quick.
Yeah.
Back to the $1,310 limit.
Okay.
What happens if you exceed that limit? Is it then tapered off?
We're going to go into that.
Tell us
we're not there yet. Okay.
Okay, so it's going to come up. Okay.
Yeah. So we're going to talk now about the employment supports or the work incentives that apply only to SSDI, to the Social Security Disability Program. So if a person gets a check on a Wednesday, second, third, or fourth Wednesday, then they are getting SSDI. The SSI comes on the first of the month. SSDI comes on a Wednesday, as do all Social Security checks, depending on the person's date of birth. If you were born from the 1st to the 10th, it's the second Wednesday. 11th to 20th, third Wednesday. 21st to 31st, fourth Wednesday of the month. So the SSDI checks come on a Wednesday, and they could be any amount, because if a person is getting benefits because of their parent, it depends on what the parent earned while they were working. If it's their own benefit because they have some work credits, then it depends on what amount of money they were earning before they became disabled. Okay, so some of the employment support or work incentive programs we have for Social Security are trial work period, extended period of eligibility, continuation of Medicare coverage, and Medicare for persons who work. Okay, so every person who gets SSDI, the check that comes on a Wednesday, gets a 9-month trial work period. That means, and they don't have to be consecutive, you can get your SSDI for 9 months and earn any amount of money without your SSDI check being cut at all. Okay, so for 9 months, it has to be within a 60-month period. Okay, so anytime you earn over $940 gross, you're using up 1 month of your trial work period. So if you work for 9 months and your earnings are always less than $940 gross per month, then you're not using any of your trial work period. Okay, so if you are working and you work for 5 months and you earn $2,000 a month, you used up 5 of your 9 months in a trial work period because you went over 940 and you're over the SGA amount of 1310, but that's okay. Okay, you're still within the 9-month trial work period, so that's not going to cut your check. It's not going to stop your Social Security check, right? So, however, as I said before, if a person, when they first apply and they don't have a decision on their case, is earning over $1,310 a month gross, then their case is going to be denied on technical ground. They don't get a trial work period. Okay. Extended period of eligibility. This happens when the trial work period ends, and it's the first. So after a person uses up their 9-month trial work period, okay, during this extended period of eligibility, if their earnings are below $1,310, we can pay them their Social Security, their SSDI check, and that SSDI check is not going to be cut. Okay. Now, if after they've used their 9-month trial work period and they're in this 36-month extended period of eligibility, if their gross monthly earnings go over $1,310, we have to stop the SSDI checks. Okay, so the month that their earnings go over 1310, we stop the check, and then they're entitled to 2 more months. All right, so this is just giving an example of how it works. Okay, now, even though a person's checks may stop because after they used up their 9-month trial work period, their earnings are over $1,310, and they don't have, we're counting the earnings, the full earnings. There's no impairment related work expense or any other things that where we wouldn't be counting the full salary. So let's assume that we're counting the full salary and it's over $1,310. Even though their cash benefits may cease, okay, their Medicare will continue for 93 months. All right, so if they've used up their 9-month trial work period and they are earning over $1,310 a month, So we stop their Social Security check, their SSDI check, but for 93 months, which is like 7 years and something in a couple of months, that means they would still have their Medicare coverage. Now, the Medicare coverage does not start until a person is on SSDI 2 years. You have to be on Social Security disability 24 months before you come on Medicare. Okay, that's not the way with Medicaid and SSI. If a person is on SSI, they come on Medicaid right away. But if they're on SSDI, they don't get that Medicare coverage for 24 months. Okay, so, and that's after the 93 months, okay? If a person still needs the Medicare, they can buy it, but Part A is $458 a month. And Part B, well, it's now $148.50. This is 2020. This is 2020. So it went up. So this 458 is going to be slightly higher, maybe 463 or something like that. That's what they're going to have to pay for. After 93 months, they're going to have to pay for Part A, which would be a little less than $500 a month. That covers the hospitalization. Basically the first 60 days in the hospital after you pay the deductible. Part B covers 80% of the doctor's benefit after you pay the deductible. Okay, so we talked about the work supports that apply to SSDI. Let's talk about the work supports that apply to SSI. Now, a person, especially a younger person, they may have both. They may have SSDI and SSI. So you got to be careful though, because some of these work supports apply to both programs, but some apply only, like the trial work period only applies to the SSDI program, not to the SSI. So if, let's say, one of your children is working and they're on SSI and SSDI, they get the trial work period, the 9-month trial work period with SSDI, but not with SSI. But SSI has its own set of employment only supports, earned income exclusions, student earned income exclusions, special SSI payments, and Medicaid while working. So earned income exclusion means that if a person is on SSI and they're working, we don't count the first $65 of their income. Okay, if they have no other income other than the SSI and the what they earn from work, we don't count another $20 from their gross monthly income. That means that would be the 85, that we wouldn't count $85 of their income. And then whatever's left, we divide by 2, and that's what's counted against the SSI. So let me give you an example. Let's say your child were earning $885 a month. Okay, so if the only other income other than the SSI is the work income, okay, so we're not going to count $20 of that, and then we're not going to count the first $65. So that means we're not going to count $85 of that $885 gross. That would leave $800. 800 divided by 2 is 400. That's what we would count against the SSI. So if there are no work supports, if they don't have any expenses associated with their disability, then of that $885, we would count 400. And that means we would subtract the 400. If they're getting $794 from SSI, minus 400 would be $394. That's what they would get in their SSI payment. And as long as they're eligible for $1 from SSI, they can stay on Medicaid. If your child is under 22 and in school full-time, okay, full-time means in college or university, 8 hours a week, in grades 7 to 12, at least 12 hours a week, or in a training course, at least 12 hours a week, then they will be considered as regularly attending school. If they're under 22, then under the SSI program, they can actually earn up to $1,930 a month before we start reducing their SSI check. We wouldn't even count. So if they were making $1,800 a month, we wouldn't count a penny of that $1,800, okay? If they're under 22, working, and a full-time student. Okay, once they turn 22, this no longer applies. Okay, so as I said, we can exclude a maximum of $1,930 from their gross monthly earnings up to $7,777 for the year. Okay, once they reach that level, once they get up to that amount, then after that, we just apply the regular exclusion, minus 65, minus another 20 if they have no other income, and then divide the remainder by 2. Whatever's left is what we would count. But if they're under 22 working and a full-time student, then like I say, up to $7,777 for the year is what we could exclude from their, meaning that would, up to that amount, we wouldn't count of their income, earned income. Okay. We're not going to do property essential for self-support. Okay, so SSI also has the 1619A provision, meaning that if the person was at least eligible for 1 month of SSI before going over the 1310, and they really need the Medicaid to pay for their medical expenses, maybe either they have no health insurance through their employer or it doesn't cover all their expenses, we could continue them on the SSI program, but maybe their wages are too high for them to get a check from SSI, but we could continue them getting Medicaid coverage. Okay, but they still have to keep the SSI rules. All right, section 1619B also is kind of similar to that if a person was eligible at least for a month of SSI and their earnings are, could be 2,000, could be three, could be approximately $3,000 a month. Okay, and they would still be, now they wouldn't be getting a cash payment from SSI because that would be too high, but as long as they kept the SSI rules, meaning that the amount of resources they have is below a certain level, and they need the Medicaid, they would stay on the Medicaid program. Now, if their earnings were too high for them to continue getting SSI, but let's say the very next month they're laid off and have no income at all, well, they just let us know and their SSI starts back up again, because it really has really not been suspended. Okay, it's just that they're not getting a payment because their wages are too high, but they really need the Medicaid, so we can keep them on the Medicaid program under 1619B, but they have to keep the rules of SSI. In other words, their income and their assets or resources have to be below a certain limit. They can't say, oh, well, I'm not getting an SSI payment per month, so now I can have as much money as I want in the bank, and I this, that. No, you have to still kind of pretend or that you're still on the SSI program in order to keep that Medicaid coverage. And remember, if your child is on SSI and they're going to get on SSDI, they're not going to get Medicare coverage for 2 years, Medicare. So what is your child going to do for the 2 years that they're waiting to come on Medicare under SSDI? So that's why for a lot of people, if possible, it's good for them to stay on the SSI program and stay on Medicaid. Okay, now with the SSI program, if a person has been in non-pay status for 12 months or longer, they have to fill out a new application. Okay. But if it's less than 12 months, then we can just do a review of the case and start them back up again. Okay, this is for blind people who want to work. So if the person is visually impaired, any kind of expense that they have that enables them to work could be, meaning whatever that expense is or those expenses are, that portion, we would exclude that from their gross wages. We wouldn't count that portion of their gross wages. So the important thing is that when a person goes back to work, they need to let us know immediately. Okay, don't rely on what your neighbor says or what you heard. Please deal with Social Security. Now, they're giving you here the national 800 number from Social Security, which is 1-800-772-1213. And it's not between 7 a.m. and 7 p.m. during COVID. I believe it's like 8 to 4:30, right? But your waiting time is going to be extremely long. Please take my advice and contact your local Social Security office. Call them. You're still going to be waiting, but the waiting time is not going to be as long as doing this via the 800 number. Now, I don't know how much, probably a lot of this can be done just online without any help at all. But remember that Social Security offices are closed except for extreme need cases, okay? And for that, you have to call first and make an appointment. Otherwise, if you can't complete the paperwork online, so it wouldn't be any paperwork, but if you can't complete the business online, okay, give your local Social Security office a call and they will set up a phone appointment when they can complete those forms and then send those for your signature if for some reason the interview can't be completed online. Okay, now, if people get checks in their own name, not if they have a payee, remember, if you get checks for your child who's disabled, okay, you're their payee, you can't set up a My Social Security account for them. But if they get direct payment, they can set up a My Social Security account, and a lot of information like wages can be reported through the My Social Security account. Otherwise, it might be they could be reported by phone, okay, or by fax, right? So the visiting or calling, that's not an option right now. Okay, if you try to go to Social Security office without an appointment, they will not let you in. There's only about 7 people in each Social Security office nationwide. Okay, most of us are working from home, so they cannot take care of normal business. And honestly, I don't know when the offices will open back up again. We haven't heard anything yet, as of yet. So please don't wait to do this, assuming that the offices will open soon and you can take care of it that way. Try to take care of your business either online or by phone. Now, I've just given you some of the programs that we have. It can be very, very complicated, okay? Please go to our website, socialsecurity.gov or ssa.gov, and in the search up above on the web page, click on that and then type in Redbook. You will get the 2020 edition. I believe the 2021 is not yet ready. It might be, okay? Either 2020 or 2021 of the Redbook. And this has all the programs that we have for people with disabilities who want to go back to work or want to start working. And they have these separated as this is only for SSI, this is only for SSDI, or this applies to both programs. So this is going to be like a kind of a Bible that you're going to use for determining, you know, what is going to be counted and what isn't. Now, also, you can also go to our website, socialsecurity.gov or ssa.gov, and over there under disability, see what we have on the website for people who are disabled, who want to go back to work. That's where we have the most up-to-date information, is on the Social Security website, because the book, excuse me, might be a year behind or 6 months behind. So whereas if you go to the website, you can see the latest information, and you can even ask questions online. You can also sign up for Social Security's newsletter, where you get the latest information on changes in the program. All right. So
Maybe I had 2 questions
for questions.
One of those was relating to SSDI and also receiving Social Security benefits at age 65? How does that work?
Okay, if a person is receiving SSDI and they're about to turn, excuse me, actually not 65 because that's not full retirement age anymore. For most folks, it's 66 or 67 or somewhere in between. If you're on SSDI and you reach full retirement age, your benefits are converted over to retirement benefits. Same amount, nothing changes, just the category changes. So now instead of saying you are a disabled person, you're a retired person. But that happens when you turn full retirement age. See, when you get SSDI, you get the same amount as though you were full retirement age. Early retirement age for Social Security is 62. If I take benefits at 62 rather than at my full retirement age, my benefits would be cut anywhere from 25 to 30% because I'm taking benefits early and I'm going to get more checks. Okay. If I get disability at 62, my checks are not cut at all. I get paid the same monthly amount in Social Security as though I were full retirement age. There's no reduction at all in benefits. So we just changed the category changes from disability to retirement when you reach full retirement age, but it's going to be the same amount of money. And you're going to have the more freedom because if you reach full retirement age and you are now classified as retired, you can go back to work and earn whatever you want. That's not going to reduce your Social Security check at all. But if you're under full retirement age and you're working and you used up, you're on SSDI and you used up your 9-month trial work period, well, your checks may stop because you're engaging in substantial gainful activity. But once you reach full retirement age, all those rules go away and then you can make as much money as you want. Because when you get regular Social Security checks, not based on disability, anytime you collect before full retirement age, if you're working, if you have work income, okay, not a pension, but you're actually working, if you have wages, they could reduce your Social Security. You have limits on how much money you can make if you're not yet full retirement age. But once you reach full retirement age, there's no limit on how much money you can make if you're working or if you decide to go back to
work. What are some statistics about the number of people that use these programs that become disabled or use SSI or SSDI?
Okay, there's about 10 million people on Social Security disability, but that includes their spouses and children. Because if I get Social Security disability benefits and my spouse is at least 62, or if we have children in the house that are under 16, my spouse doesn't have to be 62. She could get benefits and so could the children, but the children's benefits actually continue until 18 or 19 if they're in high school. Now, statistically, 1 in 4 people, younger people, will become disabled before they reach full retirement age. 1 in 8 won't make it to full retirement age. So I know a lot of people think, well, this doesn't apply to me, or you never know. Don't say it's not, because anything could happen and you could be a fairly healthy person today and be hit by a car or whatever, or ingest something or be exposed to something that could change your life forever. But, that's what we want people to understand. We have disability benefits, survivor benefits, and retirement benefits. So we're kind of like an insurance program. So if this happens, your family could be protected, or if you reach retirement, you get retirement benefits, or if you become disabled because of a physical or mental disability, then you get disability benefits. Now, as far as children, we didn't mention here in this slide presentation, if a child's parent is collecting either retirement or disability, or has passed away with enough work credits, that child would receive benefits under their parent without proving a disability, just by virtue of being a minor up to age 18. and if they're in high school, up to age 19, and then they stop. So at that point, or anytime after age 18, the parent needs to notify us and let us know that this child has a disability. Disability form is filled out. If the disability is approved, then the child is classified as a disabled adult child. And then they, as long as they're single and unable to work because of the disability, and the disability began before age 22, they can continue to receive benefits under, in most cases, under their parent. Okay, because the parent is either getting disability or retirement or has passed away. Because normally those benefits would stop at 18 or 19 if the child's in high school. But if they're classified as a disabled adult child, then those benefits continue for life. By the same token, if the child is 29 years old when mom or dad either passes away or starts getting Social Security retirement or becomes disabled and starts getting disability benefits, if that 29-year-old is single, cannot work, and shows that their disability began before age 22, okay, if that disability is approved, then 29-year-old, as long as they're single and unable to work because of a disability, would get benefits under their parent for life. Now, if a young person just out of high school and starting to work, they're going to start off with SSI. But if they are working for a certain period of time, and really for somebody under 24, they really just need kind of 2 years of work or 6 work credits. If they earn those work credits, then we will send them a letter to come into the local Social Security office to file for SSDI. So they will be getting SSDI and SSI at the same time, their own SSDI. So we have young people with disabilities that get SSDI under their parent, but we also have young people with disabilities that get SSDI because they have earned a certain amount of work credits and they are now collecting Social Security disability. Not a whole lot, but that's okay. But as they continue working, those disability benefits may go up.
Oh,
You're on
Tyler,
mute.
I believe you're on mute.
Thank you. The troubles of mute and unmute. Some other questions. Well, I was more specifically, you had mentioned a spouse is eligible to collect SSDI if their spouse is disabled and they're over 62. Can you
Yes.
say that? So did I say that correctly?
Yeah, the person, okay, if there are not children in the house under 16, then in order for a spouse to collect benefits under their disabled spouse, that spouse has to be at least 62 years old. Okay, but if there
income limits on that, if the spouse is working,
yeah, if the spouse is working, yes, but not if the spouse is getting pensions or dividends or anything like that. We don't count. The only thing we count are the wages. So if my wife is getting disability and I am at least 62 years old and I'm filing under my wife, all right, but I'm working, depending on how much money I earn, I may not be able to collect any money at all. Now, if let's say I'm older than my spouse and within 3 or 4 years I reach my full retirement age, then at that point I can file under my spouse, and it doesn't matter that I'm working or how much money I'm earning, because Social Security doesn't count those wages against me anymore. So then at that point I could file as a spouse under my wife and collect benefits. Actually, Social Security would make me file for my own and spousal benefits at the same time and give me whichever one is higher. There used to be an exception where if you were born before January 2nd, 1954, if you were full retirement age, when you file, you could file a spousal benefit first. That's if your spouse was collecting, okay? If they're alive. Otherwise, if they're deceased, that's different. But if they were collecting, you could file under your spouse if you were full retirement age, and you could file what we call a restricted application, meaning you only want spousal benefits. You want your own benefits you're not going to touch your own Social Security because you want them to grow. Because for every year you don't take your own Social Security between full retirement age and age 70, your benefit goes up by 8%. So it used to be what people used to do is when they reach full retirement age, if their husband or wife was collecting, they'd file under their husband or wife. And by the way, that doesn't reduce the benefits to the husband and wife. So if my wife is filing under me because I'm collecting disability or retirement, the fact that she's filing under me, that's not going to reduce my benefit at all. Okay. So a person would file that restricted application just saying, I want benefits under my spouse, and then turn around at 70 and collect their own benefit at either 124% or 132%. But now, if you were born after January, if you were born January 2nd, 1953 or later, then whenever you go to file for benefits under your spouse, even if you are full retirement age, Social Security is going to make you file for your own benefits and give you whichever one is higher. Okay. The only exception to that is widow or widower's benefits. If your spouse predeceases you, you could file for widow or widower's benefits first and say, I want to leave mine alone. I'm going to file a restricted application. I want my benefits. And then you could take the widow or widower's benefits until you reach 70 and then turn around and switch to your own benefits at 124 or 132%.
Got it. And one last, maybe we're getting to the end in terms of questions here. We had one question to go over quickly the terms for SSI, SSDI, Medicaid, Medicare, just kind of at a high level rehash exactly what those were and who would be eligible.
SSI stands for Supplemental Security Income, not Social Security, Supplemental Security Income. SSI is a federal assistance program which helps people who are blind, disabled, or 65 or older who have limited income and resources. Okay, the highest amount of SSI generally is $794 nationwide. Some states have the option of adding a state supplement, but basically you're going to get close to $800 a month or a little bit over that, and that's it nationwide. Okay, and you know, if your assets or resources go over a certain limit, you're going to be cut off of SSI until they come below. The SSI check comes on the first of the month and provides you with Medicaid. All right. Social Security Disability, SSDI, stands for Social Security Disability Insurance, SSDI. That comes on a Wednesday. That can be any amount depending on the wages of the person under whom you're receiving benefits, yourself or one of your parents. And that gives you, if you're on disability, you get Medicare after you're on it for 2 years. Don't ask me why there's a 2-year waiting period. That was Congress came up with this in the 60s when medical costs were very, very low. And I think it's a terrible rule, but who am I? I'm not a congressman or senator. They're the only ones that can change those rules to eliminate that 2-year rule. Now there are 2 exceptions. If you have Lou Gehrig's disease, ALS, amyotrophic lateral sclerosis, or you have end-stage renal disease, kidney failure, you don't have to wait the 2 years to come on Medicare. But everybody else who's on Social Security disability has to wait 2 years to come on Medicare, unless they turn 65 before the 2 years are up. But most people on disability are much younger than 65. So that would they don't have to wait till age 65, because after they're on Medicare after they're on SSDI for 2 years, they come on Medicare, and we automatically sign them up, Part A and Part B. They don't have to do anything. They'll get their card about 3 months before their 65th birthday, and they'll be signed up for Medicare A and B, which cover most benefits or most costs for hospitalization and for doctor visits. There are deductibles, but
All right, Tyler, do we have any more questions that we could get to before the end here?
No, we are all questioned out. And
Okay,
you did a fantastic job.
well, if anyone has any questions and if we didn't get to it, or if you have one that comes up, go ahead and leave that in the chat while I do our outro. And we'd be happy to reach out to you, those of you who are attending our webinar. Just a second, I'm going to share my screen. So on behalf of Advice Chaser, we want to thank our panelists. Thank you, Tyler. Thank you, Andy, for such great information. We also want to thank the organizations that have worked with us to bring you this webinar today. Thank you so much for our attendees for attending. Look for an email soon with a link to the replay of this event. You're welcome to share that replay with your friends and family. We will be sending out that replay soon, and we will also be hosting this recording on our YouTube channel later. Here at Advice Chaser, we're all about helping you find a financial advisor who is a great fit for your life and your financial questions. Our matching service is free to you, and every one of our advisor partners is committed to offer a free initial consultation to anyone we introduce them to. Find out more by going to advicechaser.com and clicking on the link to find an advisor. Once again, from Advice Chaser, thank you so much for coming. We'll see you at another webinar very soon. Goodbye, everyone.